Interstitial cystitis bladder pain syndrome, a situation where a woman more commonly compared to men complains of discomfort in the lower part, the region of the urinary bladder, the region of the pelvis, the perineum, the entire introitus, the vagina, urinary passage, all could be under the ambit of a difficulty, a discomfort, a kind of a pain, which she describes quite vague, but there are times she has got shooting pain. That kind of a discomfort related to urinary issues may not be a urinary tract infection. Women who suffer from interstitial cystitis bladder pain syndrome continue to have this months after months, year after year, and probably the vicious cycle of progression on both the discomfort part, the urinary complaints, the progression in changes, all these happen without much knowledge of what is happening. Attempted therapies by clinicians, which could include family practitioners, which could include gynecologists, which could include experts in the field, sometimes could get missed out a lot because probably all the aspects of history may not have been taken or given between the doctor and the patient. Important for us to therefore realize that interstitial cystitis bladder pain syndrome, a situation where you have got deep discomfort in the region of the urinary bladder, which is the lower part of the tummy, where when the bladder fills up, you have got a discomfort as the bladder gradually fills up. The adult bladder capacity of 350 to 500 ml almost can't be achieved by all these women who suffer from interstitial cystitis bladder pain syndrome. Why? It's believed that the inner lining of the urinary bladder undergoes a change, and that change is sadly a progressive phenomena where people continue to suffer gradually with flares, with on and off progression, and thereafter it stays silent. None of these women actually say that I have recovered completely during the therapies that they have been getting in the country and abroad. So when we look at interstitial cystitis bladder pain syndrome, on one side is progressive upgradation of the disease where women, what they were 2, 5, 10 years ago are not the same because all aspects of discomfort, pain, agony, the region of the urinary bladder and the urethra continue to have burning sensation, not necessarily related to urination. Discomfort and pain during the filling phase of the bladder or during emptying phase of the bladder, which could be the early presentation, but thereafter, the progress could be such that all phases of urinary filling and emptying could be uncomfortable. It could be pain, it could be burning, it could be pinching or biting kind of a pain, which changes this entire picture depending on the stage of the disease. While the disease progresses, a small subset of patients of interstitial cystitis who have got the inner lining of the bladder gradually getting denuded, deepithelialized, not getting replenished, could land up with a situation of the interstitium getting inflamed, undergoing a pancystitis, and the progression could happen with bladder gradually shrinking. Your and my bladder could have a great capacity of relaxation and contraction, which actually helps the bladder to fill up more than what you can fill up. You sometimes stretch yourself at locations where you can't pass urine, be it meetings, be it office, be it in your travel where you don't get a public toilet immediately, and you continue to live with being able to stretch and then reach at your convenience to a location where you would pass urine. That may not happen in patients of interstitial cystitis bladder pain syndrome. So whom are we talking about? Number one, women in their 20s to 60s, women who continue to have long-standing progressive change in the urinary passage, which is not normal, which is not about urinary tract infection, which is about discomfort, which is about pain, which is about pressure, which is about burning. And if all this is happening in the urinary passage, when the bladder fills up, or you get up at night with discomfort rather than getting up with a sensation just to pass urine, the sensation of bladder fullness in day and night is always about discomfort, not able to hold urine, things which are not going to get better with passing time. You need to see a urologist. At the Kokilabin Dhirubhai Ambani Hospital and Department of Urology, we look into this aspect of care where women complaining of recurrent urinary tract infection, getting infections again and again, identifying the cause, and women come and see me from across the city and the country, complaining about we are getting infections again and again. The infection, sadly, is a urine report rather than the symptoms. The symptoms may be at variance to the infection. They may have urine culture reports, which may not be a midstream in a clean cat specimen. They may have difficulty, discomfort, which does not fit into a urinary tract infection per se. So when I see women in the prime of life, with the progression that happens around where a lot of vague discomfort, which could only just be burning in the lower urinary passage or the bladder area, which just could be pain, which was initially in the early days, bladder filling and giving them discomfort, which progressively is worsening with passing time. And the bladder fills up or doesn't fill up is still in pain. Not the bladder, but the entire pelvic floor with the spasm, discomfort, with this cross-talk between various organs, and you have got bowel issues also. You got issues with your sexual activity as a woman because you can't undergo sexual intercourse as a result of the discomfort, the spasm in the pelvis and the perineum, which houses umpteen organs out there, and therefore can't really fix up who is the culprit. But when women complain of discomfort in the low urinary passage, not necessarily always hormonal endometriosis, which is associated with urinary complaints, it's time to see a urologist. It's time to pick up and identify the disease process only by a talk across the table, by clinical examination, by doing tests which eliminate a urinary tract infection, which is the commonest cause of female urinary issues that happen around. And once you've picked up all that, I think we have moved along the direction of finally now investigating, diagnosing, treating, and then moving up the ladder, scaling it up where your therapy is improving your quality of life. You don't have to go again and again to pass urine with discomfort. Your bladder does not make you run because there's a burning sensation and pain when the bladder is full, or you don't let your bladder fill up. You don't have that urgency component which is related to pain or the painful urgency. Therefore, you're not an overactive bladder where the bladder is making you run again and again. So there are women who come to me with overactive bladder or incontinence and urgency frequency at the Kokilaben Hospital and Department of Urology. When we look at that urgency frequency incontinence of urine is a lot related to women can't hold urine because this bladder is contracting erratically, little involuntarily and inappropriately at time when the bladder should gradually be filling and keeping it silent till the patient who is a master decides to go and pass urine. That doesn't happen in overactive bladder. But remember, overactive bladder is a painless situation. On the other side, confusion in urinary tract issues regarding recurrent urinary tract infection, which sadly could be more common a female phenomenon than a male phenomenon, only because the aspect of the introitus or the urinary passage opening is surrounded by the vagina and the rectum, which are close neighborhoods and friendly neighborhoods, but have got bacteria as a part of their entire paraphernalia. And that bacteria could come out post-sexual activity in cases of less hygiene, in cases of changing vaginal flora and bad bacteria taking over post-menopause, you getting recurrent urinary tract infection. Or the bacteria from the motion passage, which infect you more closely, because the distance between the urinary passage, the vagina, and the anal verge are all very close by opening together. So women sadly develop more infection than men because the very opening of the urinary passage is surrounded by bacteria coming from these two places, the vagina and the rectum. And sadly, we as women, and probably many doctors would like to blame the public toilet as a part and parcel of getting recurrent UTI. That's not true. You already have location within your body which can give you UTI, and therefore demand for hygiene in women is higher than men at all ages, more so postmenopausal, because when the hormones are not there, the area is undergoing a change. The glycogen lining of the epithelium of the vagina is changing, and the resident bacterial flora probably would disappear, giving way to much more pathogenic bacteria, which can now cause more UTI. And therefore, elderly women develop more UTI than younger women. Younger women, sexually active, not maintaining a hygiene of sexual practice, could get more UTI. But today we are talking about a painful disease, an uncomfortable situation in the bladder, in the pelvis and perineum. And many women suffer in agony in two-tier cities, including the heart of Mumbai, Delhi, Kolkata, and Madras, where we miss out perhaps the entire aspect by not being able to take as much history we take. And therefore, in such diseases, we let the patients talk. They tell us all about the genesis, the beginnings, the changes happening, the flare-up phenomena, and how they get relief. What are the food that exacerbates? What are the practices that exacerbate and how they worsen? And where they are at this point in time. And accordingly, we pull them back to a level from where the comfort levels and the pathogenic aspect of therapy moves forward. So friends, interstitial cystitis bladder pain syndrome is treatable, is also curable. There are medications for each aspect of your discomfort in the urinary passage. The UTIs, which could happen as a part of a female's process and which could flare up interstitial cystitis, can actually be brought down and looked at that you don't develop recurrent UTIs and a flare up of IC bladder pain syndrome. On the other side, the very bladder lining or the epithelium which is undergoing a change needs to be taken care of. The denudation, not being able to replenish the gag layer, and having a progression of change where the bladder lining and the inner linings undergo a pancystitis and inflammation can be halted. which leaves the elasticity of the bladder to be maintained and doesn't become a fibrous small capacity bladder. Your pinching, your pinpricks, your burning sensation, which you probably can't describe and probably it's ascribed to as UTI all the time, can all be managed around. So there are many aspects of therapy for interstitial cystitis bladder pain syndrome, from the oral therapy, from a lot of quality of life changes brought about to a lot of relaxation aspects in this disease. We've got aspects where there are therapies which are for refractory cases. There are injectables and there are intravesical therapies. I think it's time for us to look into all that in women who suffer from bladder pain, pain while bladder fills up, pain during passing urine. It's not 1 day, 1 week affair. It's a progression which is happening over days, weeks, and months. Therefore, it's a wake up call today for all women. Some men suffer lesser than women in the IC bladder pain syndrome. For us to look at that, they are not wrongly treated or not missed out in the diagnosis while a progression is gradually happening. Friends, IC bladder pain syndrome can be treated. It's important for us as individuals who suffer from urinary pain, urinary burning, urinary discomfort to see our urologist who work on the IC bladder pain syndrome. And the Kokilabhen Hospital, it feels proud to be able to treat women in the early part of disease. And sadly, those who have progressed and lived with a progression with a lot of agony can be treated by minimally invasive or by invasive therapy. The last part of the disease where the bladder becomes very short, shrunken, and probably doesn't let the bladder fill up at all. And somebody passes urine 10 to 20 times a day, and that too with discomfort and without any more relief with attempted medication, undergo a substitution or augmentation cystoplasty. So treatment is around the corner. It's important to put the health of urinary bladder to the front row seat. All overactive bladders, all incontinence, all coughing and leaking urine, all recurrent UTI is treatable. It's important to see your urologist and get it sorted as women in the prime of life, so you don't continue to live in agony of just being given antibiotics for treatment around. Giving antibiotics and treating a urinary tract infection again and again is largely a miss out data that's happening across the world, because we are guilty of not being able to ask you questions, not being able to give you leads, and not identify the factors which actually cause the recurrent urinary tract infection, the overactive bladder or the overactivity of bladder in various mechanisms and pathogenic phenomena, and interstitial cystitis bladder pain syndrome. These women's phenomena, which are related directly to urinary issues, are best treated by a urologist deeply involved in quality of life issues of the health in the urinary.